Ablation is the removal or destruction of a body part or tissue or its function. The major procedure methods are percutaneous, open, laparoscopy. The most widely used techniques include thermal ablation methods, such as radiofrequency ablation, RFA, cryoablation or cryotherapy, and laser ablation, or laser interstitial thermal therapy. Ablation may be performed by laparoscopy, surgery, or percutaneous such as hormones, drugs, radiofrequency, heat, or other methods. The radiofrequency generator produces electrical currents in the range of radiofrequency waves. Radiofrequency ablation, RFA, uses heat energy to eliminate the problem area. Cryoablation uses very cold temperatures. (1) Ablation percutaneous procedure method. Radiofrequency ablation, RFA, done by image guidance only. The patient in under conscious sedation. Using CT, MRI, or ultrasound guidance, the physician will insert the needle electrode through the skin and advance it to the site of the tumor. Once the needle electrode is in place, energy is applied. For a large tumor, it may be necessary to do multiple ablations by repositioning the needle electrode or by placing multiple needles into different parts of the tumor to ensure no tumor tissue is left behind. At the end of the procedure, the needle electrode will be removed and pressure will be applied to stop any bleeding, and the opening in the skin is covered with a dressing. No sutures are needed. (2) Ablation open procedure method. The physician performs radiofrequency or cryosurgical ablation of a tumor via an open surgery. Grounding pads are placed on the patient's legs. The physician performs an open surgery, E.G. laparotomy. Dissection, to cut to pieces, is carried down to the site, liver. Under direct visualization, the physician performs radiofrequency ablation or cryosurgical probes are inserted into the tumor. The cryosurgical probes or cryogen rapidly freeze the area being treated, the tissue is slowly thawed, and repeated cycles of freezing and thawing are immediately performed. The incision is closed with layered sutures. Electrosurgical grounding pad. A grounding pad is placed on the body, usually the thigh, before the surgery to protect the person from the harmful effects of the electricity. Ablation laparoscopic procedure method. The physician places a laparoscope via a small peri-umbilical port or through a small incision in the right upper quadrant, and an additional port is placed in the right upper quadrant under direct vision. Radiofrequency ablation is performed using a 15-gauge needle with a retractable curved electrode placed percutaneously into the abdomen at the place overlying the area of interest under direct vision. The needle is directed into the center of the lesion under real-time ultrasound guidance, and ablate the tumor. Upon completion of ablation, the probe tract is cauterized and the needle withdrawn. Ablation, open, one or more renal mass lesion, S, cryosurgical, including intraoperative ultrasound guidance and monitoring, if performed. The physician performs a laparotomy. Cryosurgical probes are inserted into the kidney lesion. A minimum of 2 cycles of freezing and thawing are performed. This is repeated for each lesion. When all lesions have been treated, the incision is closed with layered sutures. Cryosurgical ablation of the prostate includes ultrasonic guidance and monitoring. The physician places a suprapubic catheter into the bladder through a stab incision just above the pubic hairline. Next, the physician inserts a warming catheter through the urethra and into the bladder. Under ultrasonic guidance, the surgeon inserts from 3 to 8 needles into the perineum and advances the needles into the prostate. Into each needle the surgeon advances a guide wire used to facilitate instrumentation. The skin is incised and a dilator is inserted over each guide wire to dilate the channels. Saline is injected to aid visibility of the ultrasound, the guide wire is removed, and a cryoprobe is inserted through each dilator for direct contact with the prostate tissue. If the prostate thaws, the probes may be repositioned, and a second freeze may be performed. Once the prostate gland is completely frozen and all of the visible prostate tissue is destroyed, the surgeon removes the probes and applies pressure to the perineum. The punctures are sutured shut and the urethral warming catheter is removed. Submucosal ablation of the tongue base, radiofrequency, 1 or more sites, per session. Electrode placed in the submucosal tissue of the tongue base. Ablation for bone tumors. Ablation therapy for reduction or eradication of 1 or more bone tumors, e.g., metastasis, including adjacent soft tissue when involved by tumor extension, percutaneous, including imaging guidance when performed, radiofrequency. Cryoablation. Radiofrequency ablation, RFA, done by image guidance only. The patient in under conscious sedation. Using CT, MRI, or ultrasound guidance, the physician will insert the needle electrode through the skin and advance it to the site of the tumor.